Pediatric cardiac arrest kills some 2,000 children of all ages each year in this country, a terrifying reality for anyone who bears witness and finds themselves helpless. But our guest is working to get educators up to speed on how to respond to students when their heart suddenly stops. Let's welcome Tara Lawson, registered nurse and program coordinator for MUSC's Heart Safe SC program. Great to have you with us.
Thank you for having me.
It's called Project Adam, and it does more than teaching educators how to perform life-saving measures on a child who's suffering from cardiac arrest. So tell us more about Project Adam and who you're trying to reach with this.
Yeah, so Project Adam is actually a national project that is affiliated with children's hospitals across the country. And the project goes into schools, partners with school nursing, staff, administration, the whole team to come up with a cardiac emergency response plan. So in those terrifying minutes, we don't go into that freeze mode. So we know how to respond and we're not panicked in those moments.
And I can't even imagine not being panicked in one of those moments because unlike an adult that is clearly suffering from a heart attack, for instance, it's pretty obvious what they're suffering from, but in a child, you don't expect it. You don't know if they're choking on something, if they're having a seizure or some other medical issue. So just understanding those first signs of what to look for and to pinpoint what it is, because you don't want to necessarily be performing CPR on a child that isn't suffering from cardiac arrest, right?
Yeah, and the moments that we delay are crucial, right? We say in the cardiology world, we want to drop to shock time of 3 minutes, and those 3 minutes go fast, right? You think how quickly 3 minutes can pass. So the better off we can prepare, the better off we can respond in those moments, the better off the victim is going to be in the event of a cardiac arrest on a campus at a school. We know at every day 20% of the population is in a school campus. So what better place to start preparing and running those drills than somewhere where we know we have a high traffic area.
Let's talk about those AEDs.
Yeah.
So those are the paddles that we've been seeing more increasingly throughout workplaces, businesses, things like that. So first of all, what does it stand for, and can you use those on a child? Yeah,
so it stands for Automated External Defibrillator, and they are, like you said, everywhere. They're in businesses, libraries, schools, large places, Walmart, Target, places like that, gas stations, everywhere. You can use them on any age victim. You can use an adult pad on any patient. Pediatric patients only use the pediatric pad, but if you don't have a pediatric pad, you can use an adult pad on a pediatric patient. They're amazing devices that give someone a 70% chance of survival rate if they're used within the first 3 minutes of a cardiac arrest.
Despite having worked in places that have these hanging on the wall, I've never been trained on how to use it.
Yeah, so
I would be afraid to touch it, and I would be afraid to use it on somebody.
Yeah. If you can turn it on, you can use it. Really? They're made to be used and understood by someone who is 5 years old and over. It shows you pictures, it talks to you, it tells you to stay calm, call 911, all the things. Literally foolproof if you can turn it on.
So your mission is to get into schools, to get into these places where we're teaching people how to use it, understanding the signs. What districts are currently adopting Project Adam?
Yeah, so Charleston County School District and Dorchester School District 2, we are already in those schools certifying theirs. And hopefully the goal of Heart Safe SC is that will be statewide. This spring we'll be launching in some upstate school districts, and so expansion from there.
Oh, that's great. That's wonderful. For people who want more information, where should they go?
Yeah, so you can search on MUSC Shawn Jenkins Children's Hospital website for Heart Safe SC, and then my email will be at the bottom. You can send me an email and I can get you hooked up to CPR training, AED training, how, if you're in the school faculty, how to get your school certified.
Terrific. And how long does certification take?
It is, I mean, you have to come up with a cert plan, which I walk you through all of that. 8 to 10 hours, I like to say. That's like the background, but
totally
to save someone's life, hands down, definitely worth it.
Tara, thank you so much. Great to have you with us.
Thank you so much for having me.
We're back in 2 minutes.